Good morning. My name is Hillary, and I'm joined by Gabby Peruccio and Amanda Sandoval, and together we're part of the Brockton Area Prevention Collaborative, which serves the city of Brockton, the towns of Bridgewater, East Bridgewater, Whitman, Hanson, and Rockland. Today we're going to be doing a virtual opioid overdose prevention training set in the confines of COVID-19. So today's training is based entirely in harm reduction. Harm reduction is focused not on necessarily preventing drug use, but rather on preventing the harms associated with drug use. So in folks who are unable or unwilling to quit using drugs, we're really just looking for any measure of positive change to prevent harm, no matter how small. So in today's discussion, we're going to be going over what are opioids, what is an overdose. We're going to go over what the scope of the problem is, what puts someone at risk for an overdose, what are the signs of overdose, how to manage an overdose, how to gain access to the life-saving drug naloxone, and local resources. So what are opioids? Opioids are anything that comes from the opium poppy or anything that's synthetically manufactured that would sort of mimic the chemical formula of what you would find in a naturally occurring opioid. They're central nervous system depressants, which means they slow down our body, particularly our central nervous system, which includes our brain. So examples are prescription drugs that have the drug hydrocodone in it. Hydrocodone is the active ingredient in Vicodin. Other examples are oxycodone, which is the active ingredient in both OxyContin and Percocet. Other drugs are morphine or codeine or fentanyl. There are also examples of opioids that are used in medication-assisted treatment. So that would include both methadone and buprenorphine or Suboxone. You can actually overdose on any opioid, no matter how strong it is. And opioids are a drug of tolerance. So the more you use it, the more you need to use it to be able to get the desired effect, whether that is pain management or to get high from it. Some interesting facts, the United States makes up only about 4.6 of the global population, but we use about 80% of the global supply of opioids, including about 99% of hydrocodone, which is one of the most commonly prescribed drugs in the United States. Opioids actually bind to receptors in our brain, and it sort of creates a lock and key type of environment. Basically, the drug sends a message through the receptor throughout our body for us to be in less pain, which is why they're used to treat pain. They also sometimes don't bind correctly, and that can cause someone to have a really significant experience of vomiting or nausea. And then additionally, what can happen is someone can get a warm, sleepy, dreamy type of euphoria, and that's the experience that someone has when they get high from it. You can have any of those three experiences anytime you use an opioid, and what happens is when someone has too many opioids engaged in too many receptors, basically the brain's too busy processing the opioid to do what it would normally do, which would be to send a message throughout your body to tell you to continue to breathing. So ultimately what happens in an overdose is someone stops breathing. We need oxygen to go to our brain, our liver, our lungs, our heart, all of our vital organs. So it's a process by which that lack of oxygen causes those organs to shut down. What is important to know is that depending on what someone has taken, that will determine how long it will take for someone to overdose. So commonly here in southeastern Massachusetts, when we talk about heroin being sold on the street, it's really a drug called fentanyl. And that drug is so potent that someone can actually overdose shortly after use. But if someone were to overdose on a drug like, say, Vicodin or oxycodone, it could actually be a delayed response that could happen anywhere from 1 to 3 hours. And what happens in that situation is a lot of times people think that if they were going to overdose, they would overdose shortly after use. But it could be a delayed response. So someone could go on about their regular activities in their day and could overdose later. So sometimes we'll see people who will overdose behind the wheel of a car, and it could be that they didn't overdose shortly after the use. They thought that that wasn't a possibility anymore, and they continued about their day. But it is a process. When we look at the scope of the overdose issue, in 2012, overdose became the leading cause of accidental death in the United States, and that was the first time that that happened, and that has been the case ever since. So nationwide, it is the leading cause of unnatural or accidental death. In Massachusetts, in 2019, there were 1,543 confirmed fatal overdoses. That's a number that actually will continue to increase as death certificates become reviewed and finalized. So we will actually see that number go up. That equates to 5 or more people dying every single day in the Commonwealth of Massachusetts from an overdose. More locally here in Plymouth County, through Plymouth County Outreach, they provided us this data. They had that there were 1,460 overdose-related incidents in Plymouth County. 79% of those, 1,151, were actually non-fatal overdoses, and 134 were fatal overdoses here in Plymouth County. So it's important to know what puts someone at risk for an overdose. Certain things like mixing drugs are pretty high up in someone's risk factor. So that could be mixing with other central nervous system depressants, such as alcohol or benzodiazepines. Examples of benzodiazepines includes drugs like Xanax, Ativan, Valium, and Klonopin, but also mixing with stimulants, so drugs like cocaine, crack cocaine, methamphetamine, or even prescription ADHD medications can be very negative, have a very negative impact on someone's body and could significantly increase their risk of having an overdose. Tolerance is also a tremendous factor. Every day that someone doesn't use an opioid, it will actually increase their likelihood of having an overdose. So that could be that someone goes to treatment, someone goes to jail, someone has a period of sobriety. These are extraordinarily stressful times right now. So it's important to know that if someone's not used, whether it's been for 21 days because they went to treatment, or 6 months because they went to jail, or has been sober for 5 years and picks up again, it could significantly increase their risk of having an overdose. Quality control and fluctuations in purity both relate to street drugs. That could include that illegal heroin or fentanyl that's being sold on the streets, but that could also include, we see certainly counterfeit pills that are sold locally, so you don't really know what you're getting when you buy a counterfeit pill, and you might not even know that you're buying a counterfeit pill. So that has a tremendous impact on someone's risk for an overdose. An overdose cluster is when someone dies in a community of a fatal overdose, and other folks who are using in that area might actually go and try to seek out that drug, because the fact that it resulted in a fatal overdose for another person sort of tells the drug using community that that drug might be very strong, and so they'll actually seek it out. Previous overdose also increases someone's risk factor for having an overdose, and certainly so does their physical health. And in the confines of COVID-19, that's really important for us to consider. Really anything that negatively impacts someone's ability to get oxygen, so that could be as simple as a cold, a cough, a flu, bronchitis, COPD, seasonal allergies, anything like that, and certainly COVID-19, could increase someone's risk of having a fatal overdose. So when we talk about COVID, there's lots of different risk factors that interplay into addiction. So what are the additional risks that COVID-19 has on people who use substances? People who use depressants, which would include opiates, benzodiazepines, or alcohol, are at an increased risk of becoming seriously ill or dying as a result of COVID-19 because of the negative impacts it has on your breathing, like we just mentioned. Opioid withdrawal may also cause breathing difficulties, as well as if someone smokes drugs, that infection will actually worsen that problem. That also includes tobacco smoking. Additionally, COVID-19 can actually impact the drug supply, meaning people could have a harder time gaining access to the drugs that they use and could experience withdrawal either more significantly or more frequently. Treatment and Narcan are both still currently available to anyone who wants or needs it. There are some great resources that we're going to connect to this. The Yale program in addiction medicine put out a great guidance document, as did the National Harm Reduction Coalition. So with that, I'm going to pass this over to my friend Gabby, who's going to talk to us about recognizing the signs and symptoms of an overdose.
So the signs of an opioid overdose are slow, shallow, or no breathing. The person could also be unconscious or non-responsive. They may have pale, blue, or gray skin. They could be snoring or making a gurgling sound. And they could either be foaming at the mouth or maybe even vomiting. And it's interesting to note that somebody experiencing an opioid overdose could actually be awake but unable to respond. So you want to make sure that you're recognizing some of these signs, and the person may not see all of these signs, but that there could be several of these that the person is experiencing. So the difference between someone being really high versus an overdose is simply unresponsiveness to stimuli. So the person does not respond to either you calling their name or providing stimulation through the sternal rub. And we will show you that a bit later as well. So overdose management strategies, the first is to check for signs of an overdose. So you want to look for their color, you want to listen for their breathing, note the presence of foam or bubbles around the mouth, or if the person is vomiting. And then you'll want to then stimulate the person by either A, calling his or her name loudly, and then B, giving a sternal rub. And so what you would want to do is take your knuckles to the breastbone and rub very hard against their sternum. And so if that person does not respond to that, then you can indicate that the person is in fact overdosing. If you're uncomfortable touching their chest, or if they have a lot of clothing on, you can also take your knuckles and put them underneath their nose. It'll be the same uncomfortable rubbing sensation, and the person will respond. The next step that you will want to do is call 911. And if you have to leave the person to make a phone call, you want to give that person 2 rescue breaths, but put the person in the recovery position and continue rescue breathing. And then if you do have naloxone on you, you'll want to administer naloxone at that time. And Narcan is not a substitute for calling for help. If someone was just in an overdose and Narcan worked, they must still seek medical intervention. We do have some tips for calling 911, and you would like to make sure that you try to stay calm. Try to have the address and location ready for the dispatcher if possible. And then always call from a landline or over a versus a cell phone if you have the option. But again, make sure you put that person in the recovery position. Also in Massachusetts, the Good Samaritan 911 law protects those who in good faith call 911. And this law provides limited immunity, meaning that it does not protect those who have a warrant out for their arrest or enough drugs to be considered trafficking. But this law does protect the individual who is overdosing, as well as the person that is responding. So you'll see here, this is the recovery position. If you leave the individual for any reason, whether you have to get naloxone, whether you have to make a phone call, make sure to place that person in this recovery position. You want to make sure their knee is flat on the ground and the top hand supports their head. And this will really prevent the person from rolling on their back. And not, if they are vomiting, this would prevent them from choking. Then once you are ready to provide rescue breathing, please place the person on their back, tilt their chin up to open their airway, check to see if anything is in their mouth and that could be blocking their airway. And if so, you want to remove that. Then you would plug their nose with one hand and give 2 slow, deep breaths. You want to see their chest rise and then tilt their head back. So you don't want to see their stomach rise. It wants to be filling air in their lungs. So then you would give 1 breath every 5 seconds. That would be about 12 breaths for 1 minute. And then you'd want to recheck the person's breathing. If they're still not breathing, you can give naloxone and continue to rescue breathe until that person is breathing on their own or medical personnel has arrived. So make sure to stay with that person until the medical intervention has arrived to make sure that person is safe.
So naloxone is a medication that reverses the effects of an opioid overdose in the person's brain. So it's a complete opioid antagonist. The medication only works on opioids. So if a person's overdosing on benzodiazepines or alcohol or something else, it won't work on that. However, if a person has been mixing drugs, as Hillary mentioned, and it includes opioids, it will still take opioids off of the sort of person's brain so that it can help that person continue to breathe a little bit better. So it doesn't remove the opioids from the receptors in the brain, but it actually displaces the opioids in the brain and acts as a blocker. So the Narcan will go up through the person's nose and absorb through the mucous membrane, pop the opioids off of the receptor and take its place for about 30 to 90 minutes. In recent cases, it is saying that the medication actually only lasts for about 20 minutes due to the increased levels of potency in the drugs that are being sold. It's really important to do the overdose management strategies that Gabrielle mentioned, because a person can actually re-overdose if they don't get the medical attention that they need. The opioids can actually go back into the receptors in the person's brain because, as I mentioned, they're just sort of swimming around in the brain for as long as the naloxone lasts. This medication is completely safe and effective. There's no known allergies, no potential for abuse. It's legal to carry in the state of Massachusetts, and we recommend that it be stored in room temperature. It doesn't need to be put in a fridge. It doesn't need to, if you keep it in your car, for instance, it shouldn't be kept in the glove box during the summer or anything like that, because it can lose its potency. However, we do say that expired Narcan is better than no Narcan. And so when you use this medication, this is what it looks like, and you can see it in the picture. You would want to take it out of the box. So we recommend, mine's a little bit deteriorated, but we recommend that you peel off the side if you can, because when you're in a crisis, you wouldn't want to have to be trying to finagle this box and unwrap the container. So when you would have to use it, you would want to take it out. It looks just like a Flonase spray, and it's completely, an easy, usable, user-friendly medication. So you would want to just put it up the person's nostril and you just push in the medication. And so best case scenario, you would want to give that person about 1 to 3 minutes in between receiving the medication, and you would want to rescue breathe for that person in the meantime. Once you have given that second dose of Narcan, hopefully help has already arrived by that time. The average response time is about 6 minutes for EMS or police in an emergency situation such as that. So by the time you've given 2 doses of Narcan and rescue breathe for the person, hopefully help will be there and on the way. So there are many places that you can receive Narcan and get it for free. One of them is through BAMSI's Cope Center. They are a program out of Brockton, and they are an outreach drop-in center. Even during COVID times right now, they are still providing Narcan for free through their outreach services. Learn to Cope, the family support network, is also doing contact-free drop-offs to families if the medication is needed. However, they do advise, if you can, go to the pharmacy before calling them to drop it off to you at home. Through a state standing order, each insurance has a copay, just dependent on you may have to pay a little bit of a fee. So the last sort of piece before we go in sources is we talk about some things not to, as those are sort of just waste time. All of these are listed screen are things people have actually reported. People who are, recovery, people who have been in these different examples of things. But we recommend that you don't. So putting somebody in a cold bath or a cold shower is never a good idea, just because you could put them into a cold wet shower that the person could drown. But also that's creating a cold, slippery, wet adult that you're going to sort of try to be managing. It's just not a good situation to put yourself into. Don't induce vomiting. An overdose is happening in the person's brain, not the person's stomach. So helping to induce vomiting just creates a situation where maybe the person could choke. Don't give a person a drink. Again, it's not taking place in the stomach. And if you give a drink to a person, they could end up throwing up. Don't put ice down the person's pants. This will rapidly change the person's body temperature, and when a person's body temperature is being reduced like that, it actually just increases the rate at which that person's overdosing. Don't harm somebody in a way that could cause pain. So no slapping, kicking, burning. These are all things, again, that people are reporting that are being done. Don't inject the person with anything. So we've heard everything from injecting individuals with salt water, with sugar water, milk, Coca-Cola. All of these things are just wasting crucial time and could actually, exacerbate the situation. The only two things that can save a person's life in an overdose is oxygen and naloxone. So we'd like to just share with you before we finish some resources that are local. High Point Treatment Center is still open for treatment. You can access their website at hptc.org, and you can see the list of different programs that are available and the contact information for admissions, as well as currently the Castle building was closed last year, and they are repurposing that building as a safe location for providers to be able to safely quarantine. So if any local providers are in need of a quarantine space, the Castle is available for that. The Champion Plan is a police-assisted recovery program out of Brockton, and that program is still being open from 9 to 4:30 p.m. Monday through Friday. So if anybody is in need of accessing addiction resources in the community, please reach out to them. You do not need to be a Brockton resident in order to utilize these resources. We also have Plymouth County Outreach listed up here. Plymouth County Outreach is not doing their door-to-door follow-ups right now, but they do have recovery coaches available 7 days a week if somebody is in need of that peer support. And they are doing phone call follow-ups. We also have Learn to Cope listed here. Learn to Cope is a family support network that typically meets once a week throughout the state. There are a number of different meetings right now. They have suspended their weekly meetings, but they do have an online discussion board, which their website's listed right here, learntocope.org. And they do have that online discussion board available for family support. As well as the Massachusetts Substance Use Hotline. This hotline is a support hotline for individuals and family and friends of those people suffering from addiction. So they have a website that is rich of all sorts of different resources, including some sort of specific things to COVID if there are any additional questions. But they also do have a phone number as well that you can talk directly with a person on their line. So here is our contact information. If anybody has any questions or anything, please do reach out to us. Our email, our phone number is both listed there, our website, as well as our social media information. We thank you for joining us today, and please stay safe and healthy.